Welcome, everyone. It's great that we can meet in this way for an important conversation. I'm Luann Good-Gingrich, and I'm the director of the Global Labor Research Center at York University. I'll introduce our panel of speakers today and say a bit about the topic of our discussion in a few moments. First, I invite Dr. Sheila Cote-Meek, the Vice President, Equity, People and Culture here at York, to open with a land acknowledgement.
Thank you, Luann. So consistent with my own Anishinaabe cultural teachings, it is important that I introduce myself in relation to the world and the lands that we are situated on. So Bojo, Kwekwe, Simakwe, Dishnakas, Makwadodem, Temiagama, Anishinaabe. In short, I'm telling you who I am and where I come from, and I've given you some information about my role and path in this life, which English translations do not really provide a full scope of. Briefly, I come from Northeastern Ontario, from the Temiagama Anishinaabe. My traditional name is Tobacco Woman, one of the 4 sacred medicines, and I come from the Bear Clan. In many Indigenous communities, we understand our relationships to one another and the land through these introductions. We also typically acknowledge people of the land we are visiting or occupying, and I've heard similar introductions around the world at many events and conferences that I've attended, and I've come to understand their importance in reclaiming culture, tradition, and identities. They are also about asserting self-determination. When the Truth and Reconciliation Commission released its 94 calls to action in 2015, many organizations started the practice of acknowledging lands at public events and gatherings. In some instances, this has been criticized as a tokenistic gesture. In my own view, it is important that acknowledgements are meaningful, heartfelt, and move towards better understanding of Indigenous peoples. I don't profess to have all the answers, but share these thoughts as starting points. As I acknowledge the peoples of this land, I ask you to think about the lands you are located on and what the land acknowledgement actually means to you. I encourage people and institutions to reflect more deeply and ask important questions about Indigenous peoples of the land, their history, and their current context. Personally, whenever I travel to new lands, I try to learn more about the traditional peoples of any land which I find myself visiting. So while I am Indigenous, I'm also a guest to where I'm currently located. So I respectfully acknowledge that the lands where York University is located have been cared for by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. I also acknowledge the current treaty holders, the Mississauga of the Credit First Nation. This territory is also the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. I'm grateful for the opportunity to live and to work in this territory. Miigwech. Thank you.
Thank you. I appreciate that. About 3 years ago, a landmark collaborative study on racism in Canadian universities was published in the form of a co-authored book entitled The Equity Myth: Racialization and Indigeneity at Canadian Universities. The research explored in the book draws on a rich body of survey data and interviews to examine the everyday workplace experiences of racialized and Indigenous faculty members across Canada. The data reveal that the policies and diversity initiatives undertaken so far have only served to deflect criticism of a system that is doing little to change itself. This is an old story. Efforts toward diversity and inclusion fail to go beyond representation in social systems that are exclusionary by design. Without system change, certain individuals and groups are drawn inside, but to devalued and dispossessed places. This is the essence of social exclusion and systemic racism. For this follow-up discussion, our panelists will reflect on their perspective and analysis of the issues through the lens of now, this moment, the moment of COVID-19, and also the awakening of the past 2 weeks to anti-Black racism that was sparked by the slow murder of George Floyd at the knee of police in Minneapolis. Then there was also the suspicious death involving police of Regis Korchinski Packet in Toronto, receiving less attention but exposing an equally horrifying and uniquely Canadian story of anti-Indigenous racism, was the police shooting of Chantal Moore in Edmundston, New Brunswick, and the violent arrest of an intoxicated man in Kingate, Nunavut. Now, we know that the list of names of people who have suffered injury or death at the hands of police, even in the past few weeks, is long, as incidents such as these have been repeated over and over, revealing dehumanizing institutions and culture. So for our discussion today, each of our panelists has been invited to speak to the following questions as they see fit. How are deep-rooted dynamics of exclusion and structural violence reinvigorated, made new? How do emergency responses by governments, the university, and the community differently impact certain individuals and groups? And what do we need to learn from their experiences? Thirdly, what opportunities and strategies for transformation, for influencing a more just and compassionate normal are emerging? So I'm very pleased to introduce our distinguished panel for today's discussion. First, Dr. Cote-Meek, Vice President, Equity, People and Culture, will open our discussion, to be followed by comments from 3 York authors of The Equity Myth, Dr. Frances Henry, Professor Emerita, Department of Anthropology at York and a Fellow of the Royal Society of Canada, Dr. Enakshi Dua, Interim Director of the Center for Feminist Research and Professor in the School of Gender, Sexuality and Women's Studies at York, and Dr. Carl James, also a Fellow of the Royal Society of Canada and Professor of Education and Sociology at York, and he holds the Jean Augustine Chair in Education, Community and Diaspora. Concluding remarks will be provided by Dr. Shirin Shahrokni, Assistant Professor in Sociology at Glendon, York University. So Vice President Cote-Meek, I turn it over to you.
Thank you again, Luann. And good afternoon, everyone. Thank you again for the invitation to provide some opening remarks to this important and timely discussion on the equity myth through the COVID-19 lens. This panel provides an important opportunity to engage on issues relating to understanding the impact that COVID-19 has had on people. And we're fortunate here, I think, at York that we have 3 of the 7 co-editors of the equity myth, racialization and indigeneity at Canadian universities. So I just want to acknowledge the 3 panelists as well, Dr. Frances Henry, Dr. Carl James, and Dr. Enakshi Dua. I'm looking forward to hearing your comments as well. The equity myth, in my view, is, and it's noted as one of the first comprehensive database studies on racialized and Indigenous faculty members' experiences in Canadian universities. So for those of us who work and carry out research with racialized and Indigenous peoples, this is an important contribution to the research. My own research on documenting the experiences of Indigenous students and professors in post-secondary education also intersects with many of the key aspects that are contained in the equity myth as well. So I thought maybe I might start with talking a little bit about ongoing colonialism, kind of to help set the stage about why we're at this point in our society once again. And I say once again because sometimes when you work in this area, you do so much work around anti-racism and trying to create awareness and so forth, only to find yourself, you know, some 5-10 years later still doing the same thing. So I think it warrants kind of a deeper analysis and deeper discussion about colonialism. So in my view, this is important if we're to understand the current challenges, especially in my area of expertise is with Indigenous people. So understanding the current challenges that Indigenous peoples in particular face in this country during these unprecedented times. In my book, Colonized Classroom, I define colonialism as having 4 specific dimensions. 1, it concerns the land. 2, it required a specific structure of ideology to advance. 3rd was it's violent. And 4th dimension that I talk about is that it's ongoing. I just want to take a few minutes to very briefly talk about those 4 dimensions. I talk more about them in my book, but just at a very high level. For Indigenous peoples, the experience of colonization here in Canada has meant that Indigenous peoples have always been viewed as an impediment to progress, quote unquote. In other words, we seem to always get in the way of access to land and the resources within the land. And very simply, colonization also required a specific ideology that is rooted in racism to advance colonization, whereby Indigenous peoples are constructed and marked very specifically as inferior, subordinate, and dependent, and placed at the very bottom of the racialized hierarchy that exists here in Canada. Indigenous peoples' ties to the lands here also means that we are a constant threat to the advancement of colonization. 3rd, colonization always advances with violence. In my book, I draw specifically on the work of Frantz Fanon to explain the psychological impact of colonial violence. But today I want to quote the late Dr. Piscanu, who said, quote, "Despite the growing body of evidence to the contrary, the Canadian myth does not acknowledge that the nation was founded on a practice of psychological terrorism and theft," unquote. That said, it wasn't merely about taking or stealing the land. It was about how it happened. And it happened, and it continues to happen with a lot of violence, as evidenced by the residential schools, the 60s scoop, for example. And then the 4th dimension is that it's ongoing. And we can see, if we look around at the world today, we can see that colonization is still very much alive. Many Indigenous nations live in states of poverty, have no access to clean water, live in unhealthy conditions due to poor housing, lack access to meaningful employment, have higher rates of chronic illnesses, and the list can go on and on. These are just a small glimpse of how Indigenous peoples were living pre-COVID. The impact of COVID only exacerbates the inequities that pre-existed the pandemic. Many Indigenous peoples, as well as others who are marginalized and oppressed in society, including racialized peoples, also experience the impact of COVID very differently. There is no doubt that we are living and working in very challenging and difficult times. COVID-19 has impacted everyone across the globe. However, what this dialogue will bring to the forefront is that the pandemic has impacted people very, very differently. It has not affected us all equally. Indigenous peoples, Black peoples, people of color, and other groups of people who have been marginalized and oppressed were already living in very challenging and vulnerable circumstances. Keeping in mind that food and water insecurities, lower levels of employment, limited access to resources, for example, all existed for many First Nations prior to this pandemic. Imagine that even simple hand washing is difficult in some communities where the water quality is not only undrinkable, but it is not even safe to wash in and subject to boil water advisories. Further, access to medical care is limited in many communities, especially in the far north. An outbreak of COVID-19 in some communities would be detrimental to everyone. These inequalities are exacerbated during this pandemic. I'm sure this will be a very insightful dialogue, and I look forward to hearing the comments made by the panelists. On a personal note, many of you are aware that I recently joined York in the inaugural role of Equity, People, and Culture. This newly formed division was created to support the growth of equity and work towards a positive organizational culture. I believe a culture that would be more equitable, inclusive, respectful, and healthy for all. I look forward to what promises to be an informative panel and look forward to hearing from each of you as we try to unpack this issue, but also to look for solutions in addressing these inequities in the post-secondary education system. Miigwech. Merci. Thank you.
Thank you, Vice President Cote-Meek. I appreciate you setting the context for us, the historical context, as well as the Canadian context and the broader university context for us at York. Francis, I invite you to share your comments.
One of the most disastrous effects of the coronavirus pandemic is its effects on racialized people. And of course, it's no surprise to anyone who knows anything about the kind of work that I've spent my almost entire lifetime doing. It is that aspect which is of greatest concern and of interest to me in terms of implications from this pandemic. What we have learned so far is that country after country reports that the incidence of infection and death are higher in Black, Muslim, Indian, and Indigenous members of the population. That is higher than the white population. One very striking headline that I happened to notice in an American paper is, "Coronas is killing Black Americans at a much higher rate." It's rare that you see a headline like that in a newspaper. In terms of the numbers, roughly 42% of deaths in the United States are Blacks, who are actually only 21% of the entire population. In terms of states coverage, almost every state, including the very popular and populous ones, are included. Infections and deaths in other ethnic communities are more or less in line with their demographics, although there are several hotspots with large concentrations of Hispanic people. For example, in the state of Illinois, the Hispanic population is 17% and 14% Black, yet 63% of all virus cases were people of color. In the UK, recent evidence indicates that Bangladeshi people are twice, Pakistani people 3 times, and Black African people almost 4 times more likely to die of COVID-19 than the average white British population. And there is also a much higher rate among all Indian populations, Black Caribbean populations, and other white ethnic groups. So the data really shows that Black people are between 2 and 3 times more likely to be diagnosed with the virus than white people. And death rates are highest among people from Black and Asian ethnic groups. People of Bangladeshi ethnicity, for reasons that are unknown, had the highest risk of death of any population. So what are we to make of all of this? That basically Asian and Black groups are at markedly increased risk of in-hospital death from COVID-19, and contrary to some prior speculation, this is only partially attributable to pre-existing clinical risk factors or deprivation. Now, we do not have race-based data on COVID in Canada because we do not collect race-based statistics. So in other words, since our governments and various health ministry officials don't see fit to collect the data, we don't actually have any breakdown by race or ethnicity. Our leading medical practitioners seem to think it not necessary because we already know the main determinants of the illness are age, underlying medical conditions, and poverty. And such factors as ethnic origin or race are not considered to be important. Now, Ontario has recently, about 3 weeks ago, I think, said it would begin to collect race-based statistics. To my knowledge so far, and I may not be up on the very absolute latest, this has not even begun yet. So the point that I want to stress is that we have a problem in Canada that I'm sure should be no different from the US and the UK in terms of infections by race and ethnicity, but we don't have the data to show it. Now, some of the factors that are involved in all of what has been happening is occupational overrepresentation in frontline health workers and in the staffs of nursing homes, care centers, caregivers, and employees in very low-paying jobs who cannot telecommute as we are doing now, but are forced to use public transportation. Poor and immigrant women in poor-paying jobs are the people at greatest risk. They have more health problems, they have more underlying health problems, and they have less medical care than in other groups. And now on top of it, they are the main staff and the main caregivers for people who are infected with the disease. Living in poverty, of course, means having to go to work. People who are poor and who have these low-level menial jobs cannot stay at home, as we were all urged to do, because they need to work to put some food on the table. Living in public housing is another virulent factor because there is less space for living and for keeping distances, and the inability generally to keep up with safety requirements and measures. Now, we know that in earlier epidemics, although we don't have any figures for indigenous disease at the moment, but we do know in SARS, indigenous people did have higher rates of infection than did others. Now, what can we say about this? Certainly in terms of the US, where the most disproportionately affected are African Americans and Hispanic Latinos. But all these groups come from different population groups. We've also seen very high death rates in Brazil and China and Italy, for example, all of whom have very different populations using the classical definition of race. So what are we to make of this? That people who are have great similarity, but are differently spaced in different areas of the world, nevertheless all share these features. So the idea that COVID-19 discriminates along traditional racial lines is created by these statistics, but it also fails to adequately portray what's really going on. These kinds of assumptions ignore the fact that there is as much genetic variation within racialized groups as there is between the whole human population. And although this is sort of a statement that we all know, we've all learned this mantra by heart, but it's very interesting that in the analysis of what has been happening, the fact that there is such genetic variation within racialized groups, depending on where they are and where they've been living and for how long and other geographic factors and so on, is more or less neglected. But now this focus on the search for genetic explanations for societal problems means that ethnic differences are not really being given the attention they deserve. Because what we have here is what the numbers tell us, what the treatments tell us around the world, not only in one place, is we are not dealing with race, we are dealing with racism. And that has to be understood. Because in the absence of any genetic link between racial groups and susceptibility to the virus, we are left with a reality which seems more difficult to accept, that these groups are suffering more from how our societies are organized, not how they are genetically determined. There is no clear evidence that higher levels of conditions such as type 2 diabetes, cardiovascular disease, and weakened immune systems in disadvantaged communities are because of inherent genetic predisposition. Nor is there any real evidence that sociocultural, sociological explanations are useful. One theory, for example, that surfaced in the UK was that Muslims may have a lower incidence of disease because of their frequent hand washing practices. Similarly, the proclivity of some groups needing to come together frequently, for example, to pray, encourages the virus spread. Now, most of these sort of suppositions are patently ridiculous, but it's an example of what surfaces in the media and in public opinion, looking for blame within the group for their own disadvantaged state. Cultural explanations of either the presence or absence of illness are insufficient, and they are in fact dangerous. All we have to do is recall, as I'm sure many of us are old enough to do, the earlier eugenic movements around the world, which affirmed that certain races are genetically inclined to illness, to immorality, to crime, and of course to disease. I don't think that any eugenic sentiment has surfaced, at least not to my knowledge, but or among the information that comes my way, which admittedly is very limited. But I haven't seen it in any of the popular literature or in the blogs either. But it's a fear, it's a threat, the need to make sure that we don't start eugenic kind of arguments. In conclusion, let me say something about understanding Canada and US differences, because we're in Canada and this is of course our concern. Now, the research suggests that Canadians should be cautious in reaching conclusions and not automatically assume that what takes place in the US naturally holds true north of the border. To a certain extent, I think this is something we have to keep in mind. Although our numbers, if they ever appear, may look the same, but there are an awful lot of differences and different factors in the US that have promoted what is happening there, which are not present here. Now, what I kind of capture in terms of what is happening, the question is, what are the effects of COVID on the things that we looked at, say, in the equity myth, or just in looking at the prevalence of racist behaviors that have surfaced in the last period of time? To me, what seems to be happening is that the COVID pandemic and its ensuing crisis is that it has provoked, opened up the cracks that are already evident in our society's structures and institutions. It reinforces them by making them by making already evident disadvantages worse. Structures of inequality are brought into sharp relief, as for example, the nursing home staffs consisting of underpaid, already poor, often immigrant women. The relationship between people and its consequent health effects are more sharply experienced and lead to overcrowded housing where infections spread rapidly. And undercutting all these issues is always the present specter of capitalist expansion and the neoliberal world we now live in, dividing into ever greater swaths into the poor and the ultra rich, and the consequent decrease in middle-class life standards. In this morning's paper, I noticed, for example, some new study. I'm not sure how valid it is, but it had to do with the fact that the for-profit nursing homes and situations were the ones that had the highest incidence of infection, which means because their staffs are fewer in number and are paid less because their owners are in it for profit. Neoliberalism and its ugly head. We, I think, really have to consider that this is a complex situation, and we have to go back to square one. And square one always is poverty. I think we need to, well, what I'm trying to say, I think, is that sometimes one reads, certainly in blogs and the popular press, that poverty is, well, yeah, it's there, but that isn't the issue. Other things are the issue. I think the pandemic brings us back down to the relationship between the rich and the poor, and that one of the crucial factors that has exploded this whole situation is the extraordinary poverty that takes place in so many countries of the world. So I think that concludes my comments. I hope I haven't gone over time.
Thank you, Frances. I appreciate your comments. I was struck by one point in particular that you made, that in the absence of any racial genetic link, we need to acknowledge that we're not talking about race, we're talking about racism. Yeah. Ina, I hand the floor to you.
Thank you, Luann and Hajar, for organizing this panel, which is really important and topical. And I want to thank all my co-panelists for sharing their thoughts. I know I've already learned much from Sheila and Frances, and their points certainly resonate with what I've been thinking about. I'm going to organize my thoughts around the questions that, Luann, you had posed for us, because I found that they were very provocative and very appropriate for the moment. So first, how are the deep-rooted dynamics of exclusion and structural violence made visible today? And to me, I think this is an excellent question that as anti-racist scholars, we really need to be engaged with. It's certainly both COVID, but I also want to talk about the anti-Black violence in the US have brought to stark light the ways in which racism work. In the US, we can see the forms of policing that are so racialized, and the ways in which violence is systematically used against those who are Black. Not just simply the death of Floyd, but in the response of the police to the protests that took place. The ways in which the newspapers very quickly focused on the rioters rather than the thousands and thousands of people who were protesting peacefully. The ways in which the police responded, and responded in very racialized ways. Someone showed me a video that was going on Twitter of a protest in which a large white man went up to a police officer and punched him. and with his foot took the police officer's feet out from under him, and the police officer fell down. The other police officer's response was to run to this man and confront him. No, guns were taken out. No, the white man who did this act was not physically threatened in any way. In fact, the response was so subtle that he was able to run away from the crowd. And the person who showed me this was a 16-year-old. And he came and said, look, this is a clear incidence of the differences in the way in which the police react to someone who's white, who's protesting, and react to those who are Black. This kind of evidence, I think, has exploded in our awareness, and has really brought police violence against Black folks and the devaluing of Black lives into sharp focus. But I want to actually say that we need to do more work on this, and we need to talk further about this, and to start to really make connections with kind of the work that Carl does and that we've done in the equity myth. We need to make visible all the sites of discrimination and all the sites in which violence against Black folks take place. And this, really is from birth throughout their life. We know that there's been a recent study that showed that Black women's experience with birthing is very different than white women. We know that the schooling system systematically discriminates against Black students and is more likely to be punitive. We know that in universities, we have Black students are systematically harassed. They're questioned for being on campus, and that their presence is something that is suspect. They face discrimination and harassment within the classroom. We know that Black faculty also face forms of exclusion and marginalization. We know that the kind of work that we've documented in the equity myth about how workplaces work are actually similar to most workplaces, if not all workplaces in Canada, where the same forms of discrimination, marginalization, exclusion, and harassment take place. We know that in housing, the patterns of discrimination, which are not just based on income, but based on how landlords make decisions of who gets housing, which lead to the kind of patterns that we are seeing. We know that access to family doctors is also dependent on neighborhoods. And then we know social and economic policy ignores racism as a factor in thinking through how to provide state supports. So, one of the things I think the moment has really brought us is to really think through the relationship between what we are seeing substantial interest and concern about resolving, and that is policing, to other institutions. Because really, if we're to challenge racism, we really need to have a coherent and comprehensive way of understanding the racism that is taking place in policing. I would say we need a similar kind of focus in understanding the health outcomes of COVID. I want to start by saying COVID is deeply racist. It has a deep racist history. The emergence of COVID was very quickly tied to China and very quickly led to a virulent anti-Asian sentiment, both towards those within Canada, but also to those within China. And the kind of racism that COVID released has led to people being attacked, spit on, verbally assaulted in public spaces, It's led to a whole tirade on Twitter around those who are defined as Asian, and has, you know, the mental health consequences of those who are facing this form of racism in isolation is one that we haven't addressed. That's one of the dimensions of race and racism and COVID. But the other dimension is the fact that, you know, as Frances so thoroughly and eloquently pointed out, is that people of color, Indigenous people in Western countries are much more likely to get COVID and much more likely to die of COVID than those who are white. While, as Frances points out, we don't have data in Canada, and there's a clear need for data, and that has been called out to have this data. We still don't have that data, and an update is that the province has had to hire Jane Philpott to come in and reorganize public health offices so that they can provide this data. Again, it's not clear as a social researcher why it is so difficult to gather this data and why it has taken so long, given its urgency. But in this context, I would have to say that two of our newspapers, the Toronto Star and the Global Mail, have actually done a good job of reporting the way in which communities of color are more vulnerable to COVID, and have given us a glimpse of a pattern. One of the most recent articles that came out last week was an analysis of the rates of COVID by neighborhood, by where people live in Toronto. And I think it was focused on Toronto and not all of Ontario. But certainly for Toronto, what emerged was that in neighborhoods where people have lower income, there are far higher rates of COVID than in neighborhoods that are more affluent. And so we can, you know, one of the areas, you can think about the areas that are affluent: Rosedale, High Park, Runnymede, Forest Hill had very low rates of COVID, whereas the Jane Finch area had high rates of COVID. And that study actually suggests some interesting patterns. I mean, first, it's clear those are the neighborhoods where racialized people, Black people live. And so, you know, what is it that is happening here? Often, I worry that older tropes are used to explain these patterns. And I think, you know, Frances did a really good job of one of the tropes, and that is there's preceding health conditions. That is what leads these people to be more vulnerable. You know, and thank you, Frances, for, you know, for really taking us through and analyzing that around how we can't use that as an argument. And in fact, one of the scholars whose work I find really, really useful, Sabrina String in the US at University of California, Irvine, recently published a blog post, I think it was, or an opinion piece, where she looked at the data in the US and found that preceding health conditions are not a factor. When you control for preceding health conditions, which it's not just Black people who have, or people of color, all people have, the outcomes for those who are racialized and Black are far higher. And, you know, her conclusion was, I think, one that is worth sharing. It's not obesity that's killing Black folks with COVID, it's slavery. And how do we unpack how it is slavery? And I think that's one of the challenges that we have to do. Another trope that's out there is that the reason these rates are higher is that they're denser neighborhoods with multi-generational households. Now, I want to unpack both of those further and have us think about that a bit more. I'll start with multi-generational households and higher dense neighborhoods. In fact, we know that these areas are not the only areas where there's high degree of density. There's a high degree of density in the downtown Toronto core. There's a high degree of density in Rosedale, where there are also condo buildings. And in fact, a study in the US showed for New York City that the highest dense area, Manhattan, had one of the lower rates of COVID, not a higher rate. So again, I'm not sure that it's density, and I'm not sure it's multi-generational households. If we look at what's been happening in Toronto for the last 5 years with the crisis in housing prices and rental incomes, we know many more people are sharing housing. And yet they're not, they're not necessarily seen as more at risk for COVID than those who may be racialized and sharing housing. It would be, again, very easy to get data on this, but unfortunately, we're not given any data. It would be very easy to say, how many of the cases are actually cases, or what percentage of cases are people in the same household in these neighborhoods. But we don't have, unfortunately, access to the data. So I think it's important to unpack. And it's important to unpack then how these neighborhoods and where people live can lead to higher rates of COVID. And here, what I would suggest is that these are the neighborhoods in which people who are doing what's called essential work are located. They're working in grocery stores, they're working in the factories that remained open, they're working in corner stores, they're working, as Francis pointed out, they're the ones most likely to be working in nursing homes. And in fact, the data coming out of nursing homes shows much higher, that out of all the health workers in Canada, the ones with the highest rate of COVID are those who work in nursing homes. So, what I would suggest is part of what we're looking at is a relationship between racism, COVID, and work. And these were all places that were not given any protective gear. We're not seen as needing protective gear early on. And I think we have to question then how protective gear has been distributed across the city to workers. I'll give an example. One of the earliest outbreaks of COVID in a workplace that was not a nursing home was in an industrial bakery. It, really did indicate that factories were going to be a site of COVID spread. And yet, when that early breakout took place, which was way back at the end of March, early April, we didn't have a government response to say, how are we going to actually protect those workers who work in factories? So I would suggest that we need to unpack this trope that it's preceding health conditions that are leading to people in these neighborhoods having higher rates of COVID, and really look at the relationship between the work they do, the kind of protections they've been offered, as well as the rates of infection. I also want to add that one of the things we know, and I mentioned this earlier, is that family doctors are not equally distributed outside the city. Who has access to a family doctor? Who is going into a walk-in clinic? And they're critically different for those of us who've used both. Walk-in clinics don't have people's medical histories. And so in terms of trying to diagnose and protect patients, a walk-in clinic is much more limited. We also have some reported instances of how doctors, emergency workers, and perhaps those who are doing testing may respond and give treatment differently to those who are Black and those who are white. So these are, again, additional factors we need to start to unpack and take a look at. And, going back to, the density of housing, one of the things that I can see through the circle of people that I have is that there's a very different practice of protecting people in large buildings. Condos have often initiated policies that no one other than those who live in the condo can enter in. Food has to be delivered to the doorstep. The person who lives there comes down and picks it up, and has staff to clean door handles, doors, elevators. People who live in apartment buildings are not getting that support from the owners of the apartment buildings. And so again, part of protection may be what is also leading to the greater spread of COVID in these neighborhoods. I want to end by the question, what opportunities and strategies for transformation do we have at this moment? And it is an exciting moment. It's a moment where the awareness and recognition of anti-Black racism has exploded. I don't think I've witnessed a moment like this before in my lifetime. We have more, we have more government leaders talking about addressing anti-Black racism. We have more of a social commitment of addressing anti-Black racism. We have some demands that have been put out for defunding policing, which is a very important demand. So I think there's a moment where there is tremendous opportunity for transformation, but it's also a moment where we need leadership. And I'll go back to my initial point, is that, really to address anti-Black racism, we need to think through all the different spaces in which racism takes place and connect those spaces up. We need a strategy that goes beyond policing to a strategy that really looks at what the forms of racism that Black folks experience from birth throughout their lives. Thank you.
Thank you very much, Ina. And I appreciate you bringing to our attention the need to look beneath the surface, beyond the tropes, right? And to look for specific practices and processes and these connections between racism, COVID-19, and work, and to be more precise in our analyses. It's hard work, but it's necessary. And Carl, we look forward to your comments.
Thanks very much for having me and to be participating yet again on this panel with my colleagues, and to the Vice President Equity, and of course to you, Luann, for doing this again, and the timing, and Haja for doing this. Now, I thought of it in relation, we talked about COVID, and the way, when you were thinking of it, yeah, COVID was very, very significant. But also what has happened since then is a world event with regard to anti-Black racism. And it's interesting to hear everyone talking about anti-Black racism. And it's also encouraging to see, and you can keep wondering what it means when you hear places all over the world, everywhere, where you would think would not be having significant number of Blacks in their population, or have no experiences with slavery and other things, also talking about anti-Black racism. But so it tells us that this moment, as Ines said, and others have said, this moment is a significant moment. And so eventually I want to say, what are universities doing about this moment? What are universities doing with regard to what we need to address post-COVID, and what's the implication of anti-Black racism when we start addressing that post-COVID? Because as Ina and Francis have pointed out, there's the unemployment situation, there's the job situation. All those things are happening, and we're going to have to confront them after COVID and after we get vaccines, et cetera, et cetera. What's that going to mean? But let me start with the book. Sheila talked about the colonialism, and she made a point about the land structure of ideology and the violence. And I want to pick up on the point of the structure of the ideology that's important to. So how are we going to understand COVID? How we understand what's going on with anti-Black racism? We must also think of the structure of ideology, the capitalist ideology. We can't leave that aside. The capitalist ideology, the ideology of meritocracy, and how that's understood. The ideology of the neoliberal ideology that we talked quite effectively about in the equity myth, and we ground our discussion about how the neoliberal ideology is informing the way we're understanding and doing things, and therefore need to also pay attention to how that's operating. But also what Sheila pointed out was the idea of violence, and how violence as well, and how colonialism has a violent streak to it, how capitalism has this violent streak to it. So we cannot put these aside when we're thinking of COVID, or we're thinking of how these all come about. It's also reminding us of the international and the interconnected world in which we live, you know? So for me, I'm thinking about if we cordon off North America or even Canada and do not pay attention to what's happening in other parts of the world, and how the economic situation in these other parts of the world, the healthcare situation in other parts of the world are also going to be affected by COVID. So for example, if the fact that we have immigrants, and immigrants bring a significant amount of resources to our society, both economic resources and social resources and cultural resources. And those resources mean that when they bring them, they're leaving families and relatives back home. So we can take care of the situation here, but there is this interrelation. They're going to go back home. We're going to have those connections. And therefore, we have to see the interrelation between what happens in our country and what happens elsewhere. So we cannot cut ourselves off from the rest of the world. And that's important for us to think. And that's what colonialism has, and has that streak of sometimes helping us only think of ourselves, but the interrelated world in which we live is also important. I also think COVID reminds us of race and the significance of racism. So I don't think it's by coincidence that we're having all these big demonstrations with people wearing masks. And it is also significant to pay attention to how why are people going out and marching at the time that their lives are in danger? It's also interesting, why, you know, as Francis has pointed out and Ina's pointed out, the significant number of Blacks who are having this disease and dying of the disease, yet a significant number of them are going out at this time in crowds, sometimes without masks, to put themselves on the line. And you hear media asking them about that, but they know they're making a choice. So it's a very interesting point to think about. Why is that commitment? Are they seeing now, we have to wonder, are they seeing now, this is the only opportunity we have and the only chance we have to do something, and we can't lose it. We can't squander it. Therefore, we're going to have to make our voices heard. We're going to have to make our voices known. So therefore, I see COVID and I see anti-Black racism as providing those opportunities. But as I think about COVID, I also think about how it's taken up. We sometimes get lost in the individual aspect of it. The individual people who are, and it comes down to numbers. How many people are getting the disease? How many people are dying of the disease? Or but we sometimes forget the structural nature of how this happened and the significance of the structure, the significance of the culture, the significance of why inequities have brought about the situation with regard to COVID. And this inequity is not only related to poverty. And I also want to separate poverty sometimes from race, because as I think Ina's pointed out, is people, even Blacks of middle-class background who might have the economic needs, are still also affected increasingly by COVID. And when we think of some of them who are nurses and doctors at the same time, they're also affected by COVID. So we're going to have to sometimes separate race from simply class, and because we have to start thinking about how is race a factor here. And race, we're not talking, as Francis has pointed out, we're not talking about simply about race and not thinking class, but also as a biological thing, but also thinking of how the social construction of race is integrated into society, and therefore that is what is having a factor in some of the outcomes we have with regard to the differences in terms of COVID diseases and the responses we're getting. So I see those connections and important for us to pay attention to them. So the data that we need is not data to just simply tell us that significant number of racialized people in low-income areas or marginal areas have insignificant number of the diseases. Because what we miss sometimes is we are going to chalk it up to class, especially in a society who doesn't want to deal with race, we'll just chalk it up to class. And yes, the education they have, the level of occupations they have, et cetera, and not seeing how race is operated in their lives. So for example, I was listening to a podcast the other day by Dr. Williams of Harvard, and he was talking about how we have to pay attention to race, because sometimes and he talks about the cumulative aspect of racism that's having an effect on Black. So even the Black middle class will have a significant higher than their peers with regard to heart conditions, diabetes, et cetera. Indeed, when we talked about the big guy in the US who is the chief doctor, he talked about the number of his own diseases with diabetes, et cetera. So that's to say that it gets back to the point that Francis made. It's race, but it's racism, and that racism is an important factor. And I want to get back to that racism later in a while. So I want to not simply see it as individual people that's having these issues, but I want us to think of how this structure, the culture of society breeds a kind of inequity that we continue to perpetuate, et cetera. So how then do we explain, as Sheila so eloquently put, how do we explain that, yes, we're going to address COVID, but Indigenous people do not have the water to wash their hands and to do all these kind of things. So what will happen there? So it's constantly an increasing thing related to that. So what's the role of the university? I know I'm going to make sure I don't run out of it. What's the role of the university and how the university is responded? I think there's an indictment to the university about all this, because university is and I always remember my introductions to sociology and I would read all these good sociological studies, and I would see sociological studies coming out of the US that will name race and what will happen to racialized people and Black people in particular. But sociological studies in Canada never mentioned it these early years. And I'm seeing it somewhat different from Francis's work, early work where race and Blacks were named. But many of the sociologists, so some of the classic sociological studies, did not want to take up race, or race was hidden under ethnicity, as if not to see that there were fundamental differences. So all this is suggesting that if over the years, university and sociologists or social scientists were leading the way of saying, yes, race is one of those significant variables and factors, just like gender, that informs the experiences of people, then probably we would, to begin in Canada, we would have had that data right now to say, what is the disproportionate way in which Blacks, South Asians are being dealt with, or how the disease are affecting them. So therefore, we have to see, and again, in universities, universities is an institutions that push the idea of data, push the idea of research, and I've said this over and over again, but it lacks that detail about the research. Who is missing from this data? Who is missing? Whose information we need? You know, I've been on funding agencies, and we will get applications, and we're looking through applications, and we look through who's proposing to do the research, and we see all these proposals, and the proposals might sound good and so forth, and then what is never brought into that discussion is what information is missing right now from all the research we have in Canada that we need to give attention to. And therefore, shouldn't that be one of the factors that we take into account when we're adjudicating research proposal? So there is this missing here information about Blacks, for example, or Indigenous people in a particular area, or racialized people in particular areas or a particular situation. Yes, the researcher might not have had 20 years of experience of doing research, or 5 years of experience going into the area. Yes, the researcher might be a racialized person who is still coming to understand, but they're providing research for an important population in our society that I think would benefit the entire society. And so we should put that into the discussion and put that into how we assess and evaluate research and think of research. So yes, data then becomes a critical factor in our discussion. We cannot go forward with the data, but I'm very aware of my colleagues who challenge me when I push the idea of data. Colleagues who would remind me that yes, we have some data about Blacks, and what the data has been used. Data is taking us nowhere. So therefore, what is the data be used? The suspicion that racialized people have of data, the fact that the data has not served them obviously helps to build that suspicion. Therefore, universities can have to play a significant role in enabling and supporting the idea. It's not data for data's sake. It's not data for data's sake in terms of writing yet another journal article, yet another opportunity to get publicized. You know, too often the researchers doing that. It's not necessarily yet another area that we can bring a racialized person to be secondary on the research data, so that I, as a researcher, will benefit in the long run. We're going to have to, what we're pushing here is going to, from here on in, we're going to have a totally different new way of addressing the issue of anti-racism, anti-Black racism. You know, the media over the past week have been asking the question, what would an anti-racism policy or program federally mean or look like? And yes, we talk of data as one of the things. But also, I think the universities have to start thinking, what would that look like for the university? Who is missing from our list of deans, presidents, vice presidents, etc.? And what additional information would people with those backgrounds bring to the table if we were to really do a serious job at enabling others to get the opportunities that they need to get? this morning I received a text, which I quite liked. It was a text from a friend who reminded me to look at, and the text was Black Lives Matter. It says, treat racism like COVID-19. It went on, one, assume you have it. Two, listen to experts about it. Three, don't spread it. And four, be willing to change your life to end it. And I could add, there's all these other things. And I think it's significant then. It's important, there's that connection that people are making. And it means that the treatment, and as we go forward with working through this period, then we're going to probably evolve. We're hoping, one of the questions I'm asked ever so often is what do I see in the future? And is there hope? We want to think that there's hope, but I'm seduced by some readings I'm doing right now called the cruelty of hope. And I'm seduced by it because there is a cruelty to hope for some people. Because imagine this young student who lives with hope, does everything he or she can, and he gets or she gets the mentor to have the university say, yeah, come to the university and we'll provide the opportunities, etc., etc. That same institution, that same schooling system, that from the time that student went into grade 1, graded him or her on the basis of the indices that they had constructed years earlier. Yet, I'm being evaluated the same with those same indices, and the university is doing. We need to, yes, build some hope, but we also have to think and be aware that sometimes when we promise hope, we must have the institutional structures in place to make that hope a reality. Thanks.
Thank you, Carl. To make the hope a reality and to not squander the moment that we have. Some very important comments and thoughts. I wonder if we can take a few minutes to engage in a bit of a discussion. Sheila had to leave us, so I wonder if the three of you want to engage with one another.
Let me take a crack at this. One of the ideas and thoughts that came through in this discussion, and several people noted that this time is like no time before, that we are in a state of experience that hasn't happened before. And to a certain extent, I think this is true. Certainly from the time that I began looking at issues of racism, which, as you know, is many, many years ago, I have never seen an outpouring of anti-Black racism worldwide, conducted primarily by white people, according to my television screen, that is occurring at the moment. And it really gives one pause to think, why is this happening? And I have to admit, as I've often admitted before in public, that I'm a pessimist. I tend to think that this moment too will pass, and it will pass without substantive or transformative change. I just cannot see that the forces of society in general will keep the momentum going into the places where it is most needed. I think what's happening on a worldwide stage is that the world is full of very frustrated, possibly angry people stuck at home or out of work or on furlough or suffering one frustration after the other. through no fault of their own. And so what do? You take up the mantle of something. What is the mantle of today? Today's mantle is anti-Black racism. We know that because our leaders for the first time are using that terminology. And so out to the streets we rush, sometimes I'm sure with some degree of danger to ourselves and so on. But I think the more I've thought about this, and honestly, it's keeping me awake at night, I'm wondering how on earth is this going to lead to the kind of change even that we need at the most basic level. And I just do not see it happening. And I don't see it happening in the police, in any police force anywhere in the world. Because I believe that the police are so imbued in society in terms of their traditional role that, and their culture is so strong, and their methods and practices of recruitment are so strong that I just do not see how we're going to get anything more than new commissions of inquiry and things of that sort. And that change, if it comes at all, is going to be in droplets, in little bits. And I'm sorry to have to say that, but I really do feel it because I've just seen this too often. We've had a lot of crises around race before, even in Canada. Not as big as this, mind you, but it's led to what, baby steps, all told. And anyway, I've said my piece.
Now, I know we only have a couple more minutes, but Ina and Carl, I want to give you an opportunity to respond to that.
Well, Francis, thank you for raising that, because I think that has also been, for all of us who've been doing this work for many years, is that we see the performative nature of these kind of moments, that statements are made, proclamations are made, some funds may be given, but doing the systemic change is much more challenging. And, and I think that's where Carl is also called to us is important. The university also has a responsibility of thinking of how that systemic change is going to take place. But in a responsibility in conversation with so many activists and activist groups that are there. I want to add a challenge to that. I think we also, in my own practice, I can think of a number of liberal strategies to challenge anti-Black racism and racism. The kind of policies we need, bringing in more racialized faculty, supporting students, mentoring students. We've named those policies in the equity myth. I can think of those, but they're liberal policies. And what, Francis, you started us with the challenge of saying, we're also dealing with the forces of capitalism.
Yes.
How do we think of transformative policies? Because truly challenging anti-Blackness, as Black theorists have pointed out, is really challenging the fundamental basis on which, as Sheila pointed out, the fundamental basis on which our settler societies were constructed. And that means taking on capitalism. And so those radical transformative visions, I think there's a moment, there are people talking about climate. I think there are all sorts of links, this COVID has also shown us what is essential work and who gets paid for it, who doesn't. There are all sorts of moments here, but we need to think about how we take, collectively with activists, thinking through this moment to also thinking through transformative kind of programs, as well as the liberal programs. And I myself, I get stuck there. You know, if there's a time for anti-racist Marxists to step forward, we need them.
Yes, I agree. Yes.
Carl, do you have a few minutes to add a comment to that?
Oh yeah, you know, what Francis has said is from my perspective is what I think there's some truth to that. You know, the question of where do we go from here? Is there going to be any real change? We wonder. you know, that's why I come back to the whole what scholars are calling the cruelty of hope. You know, this momentum that we're seeing all around the world will give us, as Francis suggests, the false idea that there are going to be real change from this. This is the time, but capitalism remains intact, and therefore, race and racism can continue to be the endemic that they are in our society, and therefore it's going to be a while. I'm not sure. You know, one wants to live with hope. That's why we go to school and we learn. But I'm not sure sometimes if it's going to produce the hope that everybody wants. Because I keep wondering, with people marching on against what's going on right now in anti-Black racism, and when the opportunities come after this for work after COVID, and institutions are challenged and are put in place, the commitments they're making about anti-Black racism for funding, for making, putting Black people in certain positions, given the opportunities. Will those who are walking hand in hand these days and placards saying anti-Black racism, do they understand it? It's not only at the individual level we're talking about with police having the knee on a Black person, but would they understand the knee represents the failure of institutions to also employ and have blacks in their Black people in their make and in their institution. So therefore, I'm thinking, yeah, that's absolutely critical. That we kind of try to build some way in which opportunities might be realized in the long run.
Thank you. And maybe we need to keep the cracks open somehow and keep the conversation going somehow to make it possible to use the moment as best as we can. Shirin, who is unable to join us today, but has graciously agreed to take on the role of discussant today, will add her comments to the important conversation we've just had. And I want to thank you all for taking the time and sharing your insights, your expertise with us. And we look forward to hearing from Shirin.
Hi everyone, hello. I would like to start by thanking Luan for organizing this important conversation on the equity myth in the context of the COVID-19. This invitation to a second discussion is in line with one of the important ideas which came out of the first event, and that is that our conversation on race equity must be an ongoing one. And in this historic moment, the global pandemic, but also the uprising against anti-Black racism throughout the world, which followed the murder of George Floyd by a white police officer in Minneapolis, this conversation has proved more urgent than ever. So thank you again for giving me the opportunity to respond to the very important points our panelists have made and the compelling analysis they have offered of these ongoing events. In the past weeks and months, as Sheila, Francis, Ina, and Carl have persuasively showed, we have once again seen, this time perhaps in unprecedented ways in our contemporary times, that racism kills. It kills gradually, it kills silently, in covert ways, through a set of intertwined processes of oppression. It kills through structural violence, as Sheila highlighted. And to neatly capture this process, we have so clearly witnessed with COVID-19 and that our panelists have described through detailed factual evidence. I'm of course speaking of the much higher rates of cases and deaths among members of racially minoritized groups. I would like to suggest that Cedric Robinson's concept of racial capitalism is a particularly relevant one to understand this context. As you know, the concept of racial capitalism really intended to depart from traditional Marxist analysis of our capitalist system, which sees class as the only process of differentiation and stratification among members of a population. The concept also departs from what Robinson viewed as a Eurocentric and deeply distorted historical account of the advent of modern systemic exploitation. Racial capitalism captures the ways in which our modern global economic system has grown out of racial inequalities produced by slavery and colonialism, and how it has continued to produce these inequalities in our modern times. The development, organization, and expansion of capitalist society pursued essentially racial directions. So too did social ideology, as Robinson wrote in 1983. This pandemic has exposed the built-in system of racial oppression, the racial regime, as Robinson puts it, in which our global capitalist economy has operated. As Ina highlighted, in part because they have disproportionately faced precarious, unsafe, and exploitative working conditions, members of racially minoritized groups in our societies have faced a higher risk of being infected by the virus. Many of them have faced working conditions in which they have been minimally protected against the virus. A very timely, tragic illustration of this happened here in Ontario this week with the deaths of 2 Mexican migrant farm workers aged 24 and 31. These 2 young men faced intersecting inequalities in the workplace resulting from their precarious migrant status and limited rights, realities which have historically mainly targeted racialized, economically deprived migrants in Canada. The limited rights provided by their migrant status and their migrant visa has shaped the nature of their exploitative work, make them particularly vulnerable to racist incidents committed by their employers, and cause them to have only limited to no access to the Canadian healthcare system. Syed Hussein, spokesperson of the Migrant Workers Alliance for Change, raises a key point when analyzing how this structural violence has contributed to these 2 deaths. These deaths, he writes, were preventable. They were avoidable. These deaths were, unlike what the dominant discourse on COVID-19 has claimed, were not only the result of a virus. They were the result of, or a virus in isolation from the context of oppression in which it has happened. They were the result of overexposure to risks and minimal to no medical response, both of which are the consequences of racial capitalism. Departing from this narrative, the dominant discourse we have seen has so far highlighted 2 so-called strictly medical and natural risk factors, which are age and medical history. But even the latter, medical history, as our panelists have discussed very persuasively, has differentially impacted the population along racial lines. We know, for example, that racialized groups have been disproportionately affected by chronic health conditions, not, as Francis notes, because of some biological differences. Such theories have been completely invalidated, but rather, as the panelists show, and as a large scholarship has revealed, because of a range of social processes, such as state-enforced processes of residential segregation, which have led to their overrepresentation in deprived neighborhoods with poorer access to healthcare systems. As Ina discusses and explains in rich detail in the context of Toronto. These neighborhoods have also, in many cases, been closer to manufacturing areas with harmful toxins, and this has been widely documented in Canada in the case of Indigenous people. And so these factors explain in part why racially minoritized populations do, as has been documented in many national contexts, face on average more chronic health conditions than their white counterparts, and have resultingly also in this context faced greater death rates of COVID-19 than their white counterparts. Finally, as Carl carefully reminds us, the cumulative effects of racism, as research has showed, creates risks and overexposure to chronic health conditions, which are independent of class. These affect affluent Black and also other racially minority groups in our societies. I invite you, for example, to look at, and I'm sure you're familiar with this research, showing how Black women die of pregnancy-related complications at a much higher rate than their white counterparts, again, independent of their class location. Our panelists have discussed uneven distribution of the cases along racialized locally in Toronto and in the GTA, but have also underlined, of course, the scale of this systemic racism, showing how it is, of course, a global phenomenon and that this pandemic has very vividly, very clearly showed. The patterns that we are witnessing here, even without, precise data on race in Canada, have been replicated and amplified to some extent in the USA and also in the UK. I would like to add that very similar results have come out of the emergent studies on COVID-19 among racialized groups in other national contexts, such as France, for example. We see there that first and second generation immigrants of North African and West African immigrant backgrounds, therefore post-colonial immigrants and their descendants, have faced much higher death rates of COVID than the rest of the population. To add to the rich discussion on the relationship between COVID-19 and racism in our societies, I would like also to briefly highlight another dimension of this relationship, and that is the over-surveillance, the over-policing of Blacks and other racially minoritized groups as measures were being implemented everywhere to prevent the spread of the virus. As we know, racist constructions of racialized bodies as lesser, inferior, intellectually less competent, but also disobedient, undisciplined, and dangerous, have shaped the treatment that members of these populations have received from state institutions. It has shaped the treatment they have received from the police and the justice system, from the educational system, and so on and so forth. This kind of structural violence, documented cross-nationally, has its origin, of course, in racialized ideologies dating back to legitimating slavery and colonialism, and have been continually renewed in our contemporary times, and in such moments as this, as a global pandemic, for example, has so vividly highlighted. We have seen this pandemic again, indeed, that once again, Black and brown bodies have been the target of over-policing. And as Francis discussed, the underlying unspoken idea is that they are to be blamed to some extent for this pandemic. Ina also discussed the effect of this historically constructed depiction with the rise of anti-Asian racism in Canada and globally since the beginning of the pandemic. To take again the case of France, this has resulted in numerous instances of police violence against youth of North and West African immigrants since March, leading to the death of 33-year-old Mohamed Gabsi, who was subjected to police brutalities and died in probably very similar circumstances as George Floyd, although this is currently under investigation in France. This leads me to the second event our panelists have discussed and the underlying reality that it has illustrated, and which is that racism continues to kill also in the most brutal, the most visible and ruthless ways. It continues to manifest itself through the crudest forms of violence. The tragedy we have recently witnessed, which follows countless others, as we know, has led to a movement of incredible magnitude, as Carl and Ina discussed. The hope that is born out of it is that we may confront and dismantle what Stanley Cohen has called states of denial. As the author writes, denial may be neither a matter of telling the truth nor intentionally telling a lie. There seem to be states of mind or even whole cultures in which we know and don't know at the same time. So American writer and civil rights advocate Michelle Alexander, who published a piece a few days ago in the New York Times, builds on Cohen's work, noting that we know this truth about Black experiences, about the suffering, about the oppression, but we often pretend we don't. The global protests are forcefully asking the world to no longer pretend it doesn't. We know, and perhaps more so than ever, thanks to our technological, advancements and the use of social media. Protesters, anti-racist advocates have also continually showed over the past weeks that this unspeakable violence we have witnessed is but the expression of the other violence, the less visible violence, the more structural violence that systemic racism is. It has so far managed to break away with a competing reading, individual-centered, highly popular reading, in our neoliberal time regime, which has repeatedly constructed this murder and more broadly racism as the product of bad apples in otherwise progressive institutions. This narrative has systematically pathologized the racist and thereby ignored the systemic forms of oppression which fuel such instances of violence within the police. And this is where I agree with Ina that our role as scholars working from critical race perspectives is now vital. We need to build on works like the equity myth to conduct similar projects in other spaces and in places. We need to uncover the mechanisms through which systemic racial inequities structure our workplaces. We need, in other words, other equity myths, investigating racism in the healthcare system, in the government, in elementary schools, in the media, and so on and so forth. Keeping with Audre Lorde's important reminder that the master's tools will never dismantle the master's house, universities should commit to teaching anti-racist pedagogies systematically to future educators. They should commit to teaching future health professionals about racism in the healthcare systems and teach them that race is a central social condition shaping the distribution of diseases, the preventative measures, and the treatment individuals receive. Universities should themselves continue to adopt practices towards their members, students, staff, and faculty members, which show their commitment to anti-racism. This will be reflected in hires, in curriculum, in governments. Only through these changes will true institutional change, transformation happen. Now this, I agree with the panelists, will not lead to a transformative moment. Of course, dismantling racism and capitalism, dismantling racial capitalism. However, I want to believe, perhaps naively, that we have to continue to work to point to our ideal world and work towards it. Activist research, perhaps research conducted jointly with anti-racist, anti-capitalist organization, could be one way forward. I also want to believe that the realities of our globalized world may also intensify the circulation of ideas among anti-racist activists and push for a global anti-racism that is radically anti-capitalist. I know that locally, these anti-racist voices have been increasingly vocal in some places and discussing how various ongoing issues such as the ecological crisis and racism are intimately tied to a capitalist system. I have seen some of my students speak about this transformative possibility, and so I want to try and remain as hopeful as possible. Again, I would like to thank the panelists, the 4 panelists, for their extremely compelling, stimulating, thought-provoking presentations. And I would like to thank you, Luan, for organizing this event in such a timely and such an important moment. Thank you again, and hope to see you very soon. Bye-bye.